Hi, thank you for joining us for the Project Suicide Prevention webinar. I am Katherine Costello. I am a licensed clinical social worker. I work here at Safe Project with veterans, as well as I'm a clinician who works with military veterans and military families. And we're going to review the topic of suicide prevention this evening, which is a very important topic. We're going to take a look at risk and protective factors, as well as things that we can do and resources out there. These are all of my own views, and they don't represent any entity whatsoever of which I have been or now am affiliated. And again, thank you for joining us. Suicide prevention is a topic that is in the forefront of many people's minds. And I like to equate the act of being actively suicidal to what you are like when you are in the throes of a heart attack. So I know a lot of times this topic can be a little bit scary or taboo for people, but it's important that we talk about it because talking about it and knowing what to do and knowing the signs and symptoms can save lives. And I think sometimes when we think about a suicidal ideation episode, the same as we think of a physical health heart attack, it helps us know that we need to go into action and what we need to do in order to help save lives. We know there's no single cause for suicide. Suicide often occurs when there are a lot of stressors or health issues, and they converge into one experience of hopelessness or despair. Depression is one of the most common conditions associated with suicide. And depression is often underdiagnosed, but other conditions like anxiety, substance abuse, trauma, especially when unaddressed, increase our risk factors for suicide. So it's important to note, though, that most people who have a mental health condition do go on and engage in normal day-to-day lives without having a suicide episode in their life. There are over 41,000 suicides that occur each year, making it the 10th highest cause of death for all ages. And each year, self-inflicted injury accounts for 836,000 emergency department visits. Suicide is the second leading cause of death for men in the age group of 25 to 54. And men die by suicide 4 times as often as women, but we know that women attempt suicide twice as often as men. And more people die from suicide than any other motor vehicle crash. And approximately 25% of US workforce have had mental illness or substance use disorder. When we look specifically at the veteran population, we know that there has been a lot of action in the military and veteran community around suicide prevention over the past 10 to 15 years. We were seeing a high influx of suicide and suicide ideation. And so, as we know, there have been many suicide prevention campaigns and resources and different access to care put into place in order to help to mitigate the suicide epidemic. So we have seen 343 fewer veteran suicides in 2020 than we had in 2019. And from 2018 to 2020, age and sex-adjusted suicide rates for veterans fell by 9.7%. So this is 5.5% for the non-veteran community. So we do know, again, that we are seeing the actions that are being taken out there are being successful in helping mitigate suicide. The veteran population age 18 to 34 have the highest suicide rate. And this group also happens to be spending the most time on social media. So there's a lot of campaigns out there to help people identify what risks are and how to identify when someone may be suicidal when they are posting on social media. And this can be Facebook, Instagram, TikTok, Twitter, etc. The VA put out a social media kit recently, which is very useful to help those people identify and know what to do to take action when someone is posting on social media regarding potentially suicide ideation behavior. And we know that it is everyone's responsibility to help mitigate the suicide epidemic. So being able to recognize the signs and symptoms, and again, not being afraid to say something is important. Another thing we're going to talk about is guns, by far the most lethal method used for veteran suicide from 2019 to 2020. And we know that there's been an increase involving firearms. However, it's another thing we're going to talk about in this presentation is the risk and access of lethal means and the fact that means matter. So this is another area that we have seen that there's being a lot more education about what does it mean to have access to lethal means. Again, this is a social media awareness toolkit. This toolkit can be found on va.gov, and it is a great suicide prevention resource to be able to go to and take a look at different. They even post on the website different examples of what people may post online, and then ways to be able to respond to those posts. Facebook has implemented something in the past 10 years where you can report if you see someone who you may think have suicidal ideation in order to help get them care. So the suicide prevention media kit can be found at mentalhealth.va.gov and is a great resource for you. So what are some suicide signs and symptoms? Some things to look out for when we are concerned that a person may be suicidal is a change in behavior or entirely new behaviors. We know that transitions are a real risk factor for suicidal ideation and someone becoming suicidal. And so that being known, if you see someone who's going through a transition that has had a major transition in their life, losses of employment, divorce, loss of a family member, financial issues, and then you see someone changing significantly their behavior or how they're interacting, then these are strong warning signs that someone may be at risk. We know if a person talks about killing themselves, feeling hopeless, having no reason to live, being a burden to others, feeling trapped, or feeling just unbearable pain. And I say that a lot of times people really do not want to kill themselves or die by suicide. People are just feeling so much pain, whether it be physical or emotional, and they don't know how to mitigate it. So because of that, they turn to lethal means. And we know that it's a permanent solution to a temporary problem. Other behaviors that might signal risk are increased use of alcohol or drugs, looking for ways to end their lives. If you see them searching for methods or talking about methods, suddenly withdrawing from activities, isolating from family members and friends, someone who may be sleeping too much or too little, visiting or calling people to say goodbye, giving away their prized possessions, sudden onset of aggression and or fatigue. And then some symptoms that are related to mood are depression, anxiety, loss of interest, irritability, humiliation, shame, agitation, anger, and sudden improvement. Like maybe they've made this decision, so now they're expressing some form of relief. And we know that risk factors are characters or conditions that increase the likelihood that a person might take their life. So what are some suicide risk factors? Again, having a mental health condition and substance use disorder and or trauma are things we know, along with life transitions. And what do mental health conditions look like? People who are at risk with having severe depression or anxiety, bipolar disorder, and severe chronic physical health conditions. Some environmental things, again, maybe lack access to lethal means. So I will bring this up multiple times because, again, suicide is generally impulsive. So when someone has access to lethal means in an impulsive moment, particularly if they are under the influence of a substance, they may be more likely to complete a suicide. And that is, again, important just to have awareness of how we can put safety measures in place around access to lethal means. This one's under ongoing prolonged stress, harassment, sudden employment, and we do know that exposure to suicide or sensationalization of suicide can be a risk factor. Stressful life events like those transitions we talked about have been proven to be also an environmental risk factor. So again, sudden divorce, financial crisis, loss of a relationship, loss of other life, And these things we know can be risk factors in conjunction with everything else. Historical factors, so previous suicide attempts, a family history of suicide, child abuse, neglect, or trauma, and then also sleep disruption. So we know that sleep disruption and sleep deprivation have a extreme physical impact on the body. And so this can also be a risk factor. And shame and guilt, anything around shame and guilt can be a risk factor. So chronic pain, depression, hopelessness, and desire to escape through death. And then undiagnosed or untreated mental health conditions. And again, frequently people do not connect physical symptoms of insomnia and agitation to underlying mental health conditions. And because of this, when the symptoms are present, they may not be fully addressed. So again, reduce access to lethal means. Why is this important? And I've mentioned it more than once, because this is something that has been an area of study where VA.gov also has some resources at mentalhealth.va.gov under lethal means. And there are several guides on there on understanding access to lethal means and the importance of safety. And again, because many suicide attempts take place during a short-term crisis, it's important to remember that access to lethal means, whether it be a firearm, medication, during these periods can be an increased risk for completed suicide. And reducing those access to lethal means and being aware of what you can do to reduce that can save lives. So reducing access to firearms, getting medication can determine whether or not a person at risk will actually live or die. And again, most people don't want to die. They just want to stop the pain. So when they have access to lethal means, it does put it at a more at-risk situation. There are several resources to talk about means for gun safety and how to safely store a firearm, whether that be a gun safe, a gun lock. There's also prescription safety information on mentalhealth.va.gov, which can help you understand how to safely secure your medication. And also there's information on there in order to educate family members. So it will provide information for at-risk families so that they can better understand how to make sure that safety measures in place to reduce risk for suicide in your own home. One of the things we know that can lead up to suicidal ideation is barriers to care. The Compact Act has recently helped with barriers to care, and I encourage you to take a look at the Compact Act. It is something that allows for emergency care for veterans, and that you do not have to be enrolled in the VA, but emergency care is covered because, again, one of the things that can happen is if people are concerned about seeking mental health treatment, then they will potentially not seek it. But the Compact Act is set up to be able to reduce this as one of the barriers by providing that no cost emergency care, whether it be out of VA or somewhere else, and regardless of if you are enrolled in the VA. So this is something that was an executive action recently to help be one of the abilities to reduce that barrier to access to care. And stigma is important that we continue to reduce stigma. Again, thinking about mental health like we do physical health. If you had risk factors of having high blood pressure, high cholesterol, things that may lead you to potentially have a heart attack, you would treat those symptoms in order to help mitigate getting to a heart attack in the future. So if you're having anxiety, depression, signs and symptoms that would potentially, again, all converge with several circumstances, potentially lead to a suicidal ideation. If you're treating those actively, it will help reduce the impact and the resiliency factors that you have and your support systems already in place. The VA also has a training out there. It's called VA Save, and they worked in conjunction with Psych Armor. It is an excellent training for everyone, for anyone who works with the veteran population, military population, but also for family and friends. Because again, starting the conversation, having the conversation, reducing that stigma and barrier, and actually not being afraid to have the discussion around suicide and suicide risk will help save lives. And the training talks about SAVE, and it is recognizes symptoms of suicidal thinking, ask the questions, and really, truly, I always tell people again, if you are concerned about someone, ask, are you thinking of ending your life? Be direct. There's a lot of misconception that if you ask the question, that it's planting a seed that wasn't already there. But really, if you ask the question, it is the best way to be direct and see how the person responds. Validate the veteran's experience and encourage treatment and expedite getting help. And this is an excellent training, again, for friends, family members, anyone who has a veteran in their life, just so that you can better understand how to be direct and be able to start the conversation. And that is another resource on mentalhealth.va.gov about starting the conversation. And I think a lot of times people are concerned that they aren't going to know what to say. So again, that social media toolkit that they have was really helpful because it walks you through actual responses and actual posts that people may put up and knowing how to say it. But here's some responses that can help in actually encouraging, because a lot of times just giving hope, listening, again, and engaging and connecting can save a life. So letting people know they're not alone, even if they feel like they are, letting people that you know that they're hurting and you're there for them and you want to help. Knowing that they may feel like there's not any hope right now, but that this again is a temporary feeling and that it will change. This too will pass. It will not stay this way. And that suicide is a permanent solution to something that's temporary. So this will change. It will not be this way forever. And I might not exactly be able to help you understand what you're going through or how you feel, but I'm there and I want to help you. And when you want to give up or feeling overwhelmed by emotion, try to just focus on getting through the next minute, hour, day, whatever you can manage. So really encouraging staying in the moment, staying in the present, knowing that things will change and being able to find the ability to stay mindful in the moment you're in. We do know that there is therapy and treatment for to provide resiliency. Again, like I said, if you were having symptoms that were similar to something that could lead up to a heart attack, you would treat those symptoms, hopefully. That's on the physical health side. And then, I equate again the actual suicidal ideation, active thoughts of suicide, access to means, active plan, that being the actual heart attack phase. And that's when you're going to do what you need to get someone into emergency care through either 988 or taking to the emergency room, or through emergency care that you enact, such as you would if someone was having a heart attack. But we do know that therapy and medication work for depression, anxiety, other mental illness. We know that you can work through treatment towards recovery with substance use, and that you can work for treatment through recovery with trauma. So if you are actively seeking to put some safety nets in place through therapy, medication, and other means in order to build that foundation. Some evidence-based treatments are cognitive behavioral therapy, for insomnia. There's mindfulness, cognitive behavioral therapy, cognitive processing therapy. We know it's actively been used to treat trauma. EMDR has been very successful with trauma. Prolonged exposure therapy has been used a lot with sexual trauma. There's acceptance and commitment therapy and dialectical behavioral therapy. So these are some that have been proven evidence-based therapies to help provide some of those resiliencies. And then there's complementary and alternative medicines. So not everyone may want to seek traditional therapy, and not everyone may want to use medication. But we know that meditation is a excellent resource to be able to help mitigate stress factors. We also know that alpha stim is something that's out there that the VA offers, and that it's utilized for a lot of people to help emotional freedom techniques, yoga, acupuncture, relaxation. The Calm app and Insight Timer are two that a lot of people use for ongoing ability to utilize relaxation techniques. I believe Calm app, at least at one point, provided a discount for veteran care and veteran access, but I know Insight Timer is a free. And it's something you can access, download, and use. And it is something that if you use daily along with meditation and other forms of alternative complementary medicine, can really help you, again, have that mindfulness. And again, some people don't want to do direct therapy, so they will do peer support. Peer support have been proven very effective to work with a peer, and there's several peer support groups out there. Vets for Warriors is it's VETS, the number 4 Warriors is a great program. There's a lot of other peer support programs out there, and Vets for Warriors is a program that if you called, you would get a veteran on the line who would understand, and anyone can access it and utilize it as well. There's public health and community programming, outreach, education for communities and families. The VA, mentalhealth.va.gov, has a lot of great resources and tools under their mental health and suicide prevention pages, again, not only for the veterans, but for their families. Again, it's important to understand access to lethal means and really how important that is to understand, to be able to know how to keep firearms safe and secure with a safe gun lock, as well as medications, in order to understand how to reduce risk factors for suicide in your home with access to lethal means. And then offering skills and other preventive strategies to address major stressors, and gatekeeper training family members. Again, the VA SAVE program is an excellent one. There's a lot out there on understanding myths of what suicide is. A suicide prevention webpage for VA has a lot of resources, like I said, and then the social media kit, again, tells you even how to respond directly on social media. And again, you can tell like the VA SAVE training, because it is very good. Psych Armor and VA did a great job with coming together with this and being able to provide this training that's free and helps you understand signs and symptoms and what to say and what not to say. And the National Shooting Sports Foundation promotes another way of learning about means safety. Caring letters is something that focuses on military letters to veterans during the year after initial documented call to the Veteran Crisis Line, which is that 988 number, or 800-273-8255. These are numbers that you can call 24/7, 365. And Caring Letters is a group that the initiative has been found to reduce the rates of suicide, death attempts, and ideation through these letters. And in the peer support outreach call center, there's the one staffed at the VA, but then also other programs like Vets for Warriors. Some great resources out there are that suicide prevention hotline. There's that number, or now, again, it's been initiated that 988 is just a direct dial, such as 911. You can always call 911 if you really are needing immediate access to care. And there again, 988 suicide prevention crisis line is open. It's 24/7, 365. The Virtual Hope Box, again, is another app that has been proven to help with suicide prevention and providing resiliency through providing hope. And then again, you can always contact us here at Safe Project for resources and finding support. VA.gov also has some great mobile apps, which are available. And I encourage you to go to mobile.va.gov and take a look at some of those apps that are available, that are out there to provide resources to family members and to service members and veterans to be able to put right on your phone. And they are available. There's a lot of different ones out there that you can use that are available to you to be able to access on your phone directly. There's Annie for clinicians, and there's a mindfulness coach. There's a PFA mobile app. There's just a significant amount of resources at mobile.va.gov for family members and caregivers, healthcare professionals, and for veterans. So I encourage you to take a look and use some of the resources that are out there available. And then Psych Armor also has several apps, but also several free trainings that are available for veterans, family members, and friends, whoever wants to use it. Again, it's a no-cost free training, and I highly encourage you to utilize these. So again, thank you for joining us. We really appreciate that you came and were able to join us for the webinar today. I also hope that you will take a look at some of these resources that are out there, and knowing the signs and symptoms can help, and being able to know that it is important that we all know that it is all of our responsibility to see something, say something, and interact, and that we know that we all have a responsibility to help with mitigating suicide risk. Again, appreciate you joining us, and reach out to us if you need any more resources. 988 is a great in-crisis number, and then some of the other resources are great for you for ongoing information. Thank you again.